My name is Jessica Stanley, and I'm conducting exam number 3, focused musculoskeletal and neurological exam on Benjamin Stanley.
Hi, my name is Benjamin Stanley. I consent to this exam.
Okay. Hi, my name is Jessica. I'm just going to be your nurse practitioner. How are we?
I'm good.
Any concerns you have today?
No.
Okay. So we're going to start with your temporomandibular. So clench down, go left to right. All right, bring your chin to your chest, look up to the ceiling, look left and right. Now bring your left ear and your right ear to your shoulder. And I'm just inspecting your shoulders, shoulder girdle anteriorly and posteriorly. Your scapular muscles are pure normal. Now raise your arms up and over your head. And now extend your arms back behind you. And now cross your arms in front of your body. And now, so what I want you to do is place your left hand behind your back and touch your shoulder blade. And now do the same thing with the other side. Okay, and now I want you to do the same thing, but do one hand up above and behind, and the same on the other side. Okay. Now bend your left and right elbow. So take a seat, and I want you to extend and bend. Palms up, palms down, and palms up. Okay. So next we're going to assess for your flexion, extension, abduction, and adduction. So we're going to test your fingers and thumbs. So make a fist for me. Now I want you to fully extend and spread your fingers out for me and touch the thumb to the base of your palms and lift the thumb up and away from the midline. And then what I want you to do is move your thumb away from the hand and back to the side here. Now touch the tip to each finger. Okay, great. So now I'm going to assess the rotator cuff injury. So Ben, can you raise your arm to a 90-degree angle? And I'm going to stabilize here. And then I just want you to slowly lower it back down to your side. Okay. And then for the near impingement test, I'm going to, so stand up here. I'm going to press on your scapula and I'm just going to raise your arm. Any pain or tenderness?
Nope.
Okay. So now I'm going to have you sit down. I'm assessing the strength of your upper extremity. So palms up. And I just want to place my arm on your inner forearm. And I want you to pull me towards you. And then I want you to push away from me. Okay, great. And next, I would like you to flex your elbows. And I'm going to put some resistance at your wrist, and I want you to flex and extend. So towards me and away from you. Now, to assess your wrists, we're going to try to check for extension. So make a fist. Put your arms out in front of you like this. And then I'm going to try to push down on your hands while you resist. Okay. So now I want you to grab my 2 fingers, squeeze really tight. Don't let go. Okay. Next, I want you to spread your fingers out for me. And I'm just going to put some resistance on the outside here. Now press against, and then same here, and press against. Okay, great. So we're going to assess your hips. So I'm going to put my hand on your thigh, and we're just going to have you push up and down, and up and down. Great. So now we're going to assess the tibial sign. So just going to tap here. Any numbness?
Nope.
Okay. Now the Fallon sign, we're going to do this. And tell me if you feel any numbness. We're going to go there for about 30 seconds. For the sake of this video, we're just going to stop. So I'm going to have you stand up so I can check your spinous process. Now bend down all the way as forward as you can. And then extend all the way back as far back. Now rotate side to side. And then bend laterally to each side. Okay. And I'm just assessing your gait. So just step forward a quick minute for me. And everything's normal. So I'm going to have you lie on your back, bend your knees to your chest, one at a time, and pull it. Okay. While I have you here, I'm going to check for meningeal signs. So the Brzezinski sign, I'm flexing your neck here. I don't see any flexion of the hips or knees. And the Kernig's, we're just going to have you flex a little bit. Any pain?
Nope.
Okay. So now lay face down, bend your knee, and push up to the ceiling. Same on the other side. Now turn back on your back. I'm just going to move your left lower leg away from the midline, toward the midline, I'm going to externally rotate and internally rotate. Okay, and then we're going to do the same. So we're going to go away from the midline. So away from the midline. And then we're going to go toward the midline and then internally rotate and externally rotate. And then we're going to do the internal rotation and external rotation. So the meniscus injury, we're going to do the McMurray's test. So I'm going to have you just flex to the knee, and I'm going to grab your heel. And I'm going to touch the medial and lateral joints, and I'm going to internally and externally rotate the tibia. And then while externally rotating and internally rotating, I don't hear any clicks here. And then for ligamentous injury, using the valgus varus, we're going to just not fully extend quite. And I'm going to secure you here. And I'm going to put my hand on your knee. And I'm going to put valgus by pushing medially. And varus stress is going to push laterally assessing the LCL. And then with your hips and knees flexed and your knees flat, I'm going to sit on your feet here. And we're going to do the anterior posterior draw test. We're going to pull and push. Okay. So extend your left leg. I'm going to palpate for the bulge. So I'm going to press gently on the medial knee and the lateral knee. And while you're here in extension, I'm going to test for the balloon sign. So I'm going to palpate the suprapatellar pouch, which is negative. And lastly, I'm going to grab the knee above the patella with my finger and thumb, and I'm going to push the patella against the femur. All right, so bend your left knee for me. And checking, so actually sit up for me. So just put your foot up and down, same. I'm gonna have you bend your, I'm gonna have you internally rotate and externally rotate. And we're gonna do internal rotation and external rotation. And then we're gonna assess for plantar flexion. So I want you to point your feet to the floor to extend, and then point your feet up to dorsiflex. And then I want you to bend your heels inward and outward for eversion and inversion. So then we're going to move on to lower extremity strength. So while you're here, relax. I'm going to touch your lateral knee. Don't let me push your legs together. And I'm going to go medially and now try to push in. Okay, so there's good strength. So now let's assess for flexion and extension. So try to straighten your knees against my resistance. And I'm going to grab your calf and do the same thing, push back towards you. Okay, so for ankle dorsiflexion, we're going to have you step down. Now sit down and pull up against my resistance. Now push down, push up. Okay, so now we're going to do the cranial nerve. So I want you to smell this. What do you smell?
Peaches.
Okay, so we're going to do cranial nerve 2. Tell me the smallest line you can read.
LTFPH.
Okay, so then we're going to test for visual, ocular motor movements. Then we're going to do cranial nerve 5. Can you tell me if you feel me touching here?
Yes, yes.
Light or dull?
Light.
All right, give me a big smile for now. Raise your eyebrows, puff your cheeks. Okay. Now let me know, close your eyes. Now let me know which ear you hear me in for nerve
Right.
7.
Left.
Okay, so 9 and 10, we're gonna have you say ah for me. Okay, great. And I'm just gonna check your gag reflex. Okay. Now I'm gonna check cranial nerve 11. Raise your shoulders and down. And then stick your tongue out for 12. And now put it to the roof of your mouth and touch your cheek with your tongue. Okay, great. So all the cranial nerves are intact. So coordination, I want you to do some finger to nose. So put your finger to your nose. Now to my finger. Again. Again. All right, now stand up. Now I want you to put your heel on your shin. From heel to shin. Now I want you to just walk on your toes there to that white thing. All right, now the Romberg's test, we're gonna have you stand, close your eyes, 30 seconds, and I see that it's normal. And we're gonna assess for pronated drift. So I want you to stand for 2 minutes with your eyes closed, palms out. Close your eyes. Okay, that's negative. And then sensory systems, I want you to have a seat. So tell me if you feel sharp or dull. Sharp or dull. Eyes closed.
Sharp, dull, sharp, dull.
Okay. Next, we're going to test for stereognosis. So what I would like to do is have you close your eyes and tell me what this object is.
Quarter,
And the other hand.
a battery.
Okay. Now tell me with your eyes closed what you feel me tracing you.
An A.
Okay. All right, now we're going to test for 2-point discrimination. So let me see. Close your eyes. Are you feeling me? Tell me where you're feeling me.
My palm. My shoulder. The shoulder.
Okay. And then we're going to have you, I'm going to test for extinction. So have you close your eyes. Tell me where you feel me touching you.
My cheeks. My head.
Okay. So next, we're going to check your reflexes. So first, the brachio. So actually, we'll do this. Bend your arm a little bit. Okay. And then your tricep. Just relax.
Yep.
And then your brachioradialis. And then we're going to have you relax this for your patellar.
Yep.
And then we're going to do your Achilles. So I want you to push your foot up. Okay. And that concludes our exam, okay?
Okay,
Thank you.
thank you.